How do you respond to the situation in Leicester?
Yes, I mean, I guess the sad thing is I think it was predictable because the virus is still here and it's circulating at a high level. And so we have currently this, false dichotomy of the only choices being lockdown or nothing, where I think there hasn't been enough investment in public health infrastructure like testing and tracing systems like South Korea and Taiwan to get out of lockdown, but in a way that means you don't need to go into it a few weeks later when the virus starts circulating again.
Could Leicester be a one-off? I mean, everybody will hope that it is, but in your considered opinion, is this likely to be a scenario we see replayed in other parts of the country?
Yes, I think it's a glimpse into the future, especially given that the strategy seems to be to just let the virus go. And at a certain point, if it passes a threshold, perhaps it's going to breach NHS capacity in that local area, then you implement a lockdown. I don't think there's really a strategy. Like I was trying to look ahead and say, okay, where are you trying to be in 6 to 8 months? Because we're heading into winter, we're having pubs opening, we're having indoor locations opening, and people want to go back to their lives. But I think if you look across at the states, I mean, at Florida, my home state, or Arizona or Texas, we can kind of see our future ahead if you don't have infrastructure in place to suppress the virus through testing and tracing.
Are there any, I hesitate to ask this question just in case the answer is not one that anybody would particularly want to hear, but are there any grounds for optimism here? Anything that you could say, actually, if X happens, then we'll all be okay?
Well, I think at a national by national level, there are countries finding a way through. And that's what I guess Scotland's been trying to do. Scotland's had now 4 days with no deaths, just a handful of cases. And there is light that I think within weeks, if we can get a handle on imported cases, that we would be COVID-free, similar to, I guess, as good as you're going to get. You'll still have bumps, you'll still have clusters, but you won't have widespread circulation, which means you get back to more sustainable recovery. Schools opening and hopefully not closing a few weeks later, businesses able to, open without the 1 meter, 2 meter debates. But it really requires a commitment by the government to a zero COVID strategy. It's achievable. Ireland's doing it. Northern Ireland's doing it. Scotland's doing it. So the question is, when is England going to change course and join and push towards that goal?
Is that a when for you rather than an if? I mean, regardless of whether they realise it now, your position seems to be that they will have to adopt that point. Because a vaccine may deliver it, so they might just be hanging on for a vaccine. But in the absence of a vaccine, then is it a when or could it still be an if?
Yeah, I mean, I guess there are a few big questions. One is the vaccine or potentially a very effective treatment. Another one is if the virus will mutate, but we're all hoping for, to a milder form. And that means that actually this slowly just becomes an endemic seasonal cold like other coronaviruses could be. But absent that, especially if immunity is not lasting and if the health effects stay as dangerous as they are, I could see us having this exact same conversation in 6 to 8 months after we've been through winter. And in some ways, the public saying, lock us down for 3 weeks, aggressively go after the virus. We'll sit at home, do the testing and the tracing, figure out who has it, let it burn out, and then we can get on with our lives. And hopefully that won't be the scenario in 6 to 8 months, but it potentially could be if we have a bad winter.
Of course. And I mean, 2020 hindsight is a wonderful thing. And there seems to be a broad consensus in your world that we in the whole of the United Kingdom went in late, although different parts of the United Kingdom seem to have locked down more effectively than others. I mean, I don't know how much time you've had to look at what specifically is happening in Leicester, but is there clarity there on what people can and can't be doing? The anecdotal evidence, when you stick a microphone in the face of some poor soul stuck at a bus stop on her way to work in the morning, is that they haven't got a clue whether they're coming or going. But does the science or does the strategy work? Does it make sense to you?
I think the messaging has been confused. And I think this is what we found throughout this lockdown, that if people know what the rules are, they do want to follow it. There is a real sense of community. And I think one big difference between Scotland and the UK message was when the UK went to stay alert. Scotland stayed with stay at home. The virus is still there. We still got to come out of lockdown. We've still been progressing through it. It's just been more cautious and also building the testing and tracing alongside it through local public health boards. But I think the messaging is exactly right, as you're saying, because if you don't really know what to do, if people say go to the beach, you're going to go to the beach. If people say go on holiday, you'll go on holiday. But that may not necessarily be the optimal thing for public health at that moment if everyone does that.
And finally, Professor Sridhar, the question of the app, because there's still a lot of confusion, and I think it's forgivable confusion for most of us. The notion of testing and tracing being effective in the absence of an app, in the absence of the sort of technology that's been deployed in Germany and elsewhere, is that something that we could have a little bit of faith in? Or do we need an app for the testing and tracing to have teeth?
Well, I think the key thing is that most countries have on an app for their core testing and tracing. If we look back at an app is like the icing on the cake. You got to have your human tracers who are going after it. It's detective work, right? And figure out who's someone been around, who they've been around for the past week. And if you can get an app on top of that to help support those humans who are doing the tracing, then that's fantastic. But I think to just rely on an app and see it as a silver bullet is mistaken. This is down to people, trained investigators who go after this and get people's trust to tell them where they've been. And then you can use an app to support that. But you need trust. People have to download the app and use it. And that's a big ask.
Sorry, I said that was my final question, but I'm going to allow myself a supplementary, if you will. Does that not shift slightly, that answer, according to events? Because if people are generally behaving quite well, I can completely see how human testing and tracing is the cake and the app is the icing. But if we look at some of the scenes, whether it's, protests on city streets or throngs on beaches or illegal parties or whatever it may be, there's not much chance of human testing and tracing making a dent in those sort of numbers. If I'd been at Bournemouth Beach last weekend, what are the chances of me being able to give names and contact details of everybody I had conceivably come into contact with?
Yep, that's exactly right. And I think a big difference is you haven't seen these kind of big crowds in East Asian countries until they've basically eliminated the virus, until they've said, look, it's negligible, it's no longer circulating. But I'd also flip it over that you need people to download the app. And most countries have struggled with that. I mean, Germany's made headway trying to get people to download it. But just ask yourself, would you download an app and have it on your phone? And it means your movement's being recorded. Requires you to know, how is that data going to be held? Who's going to have access to it? How will it be used? So it requires an open conversation about kind of privacy. And I think we can get there, but you can't just force it on people. You have to take them along with you and tell them how their data is going to be protected, especially now, given that, there are worries about how data might be mined for other purposes.
Clarity and leadership in a government which already has quite a strained relationship with public trust in data collection. Latest possible date or earliest possible date on which you can go back to your normal life, your post-pandemic pursuits?
Oof, I think globally, we still haven't hit the peak in terms of this is still taking off in most low-income countries. And so I think the whole pandemic is going to, we're just at the early to middle phase. I think countries like the UK made a commitment. Let's say they said in 3 months, by September, by October, we want to get rid of this virus, get back to normal life, but have border checks to catch imported cases. We could get there within a few months, but that requires right now a huge push and buy-in to say we'll have the short-term pain, we will take it. Businesses will buy into that to say, okay, we'll get through this in a few months. Otherwise, I think we might get into these lockdown and release cycles, which will be much more destructive to the economy. And businesses might also be questioning, is that really sustainable for them?